This is Chronicles of Moving Mountain, and I'm going to go over my healthcare proposal. And I tried to make a recording of it and try to spread the news. So anyway, with God's grace, I hope that somebody from the White House will hear this. So I wrote this entire paper. It's about good 6 pages, but I tried to make it as comprehensive as possible so that we reach to as many people as possible. But I wanted to have clear, definitive goals that gradually increases the access to citizens based on the care, coverage, and the cost. So we cannot force everybody to just have healthcare, because if the moment you increase the demand for healthcare, the more you have to give the supply. But you can increase both access, reduce the cost, and provide the care by having reasonable goals. And you also have to take into consideration what is costing the citizens, what is costing the state, what are the health benefits, what are the factors that are affecting health. So it's multifactorial. So I wanted to propose this free market 2-tier, and it's basically where you have a baseline that is more government subsidized for people with low income, giving them a wellness card that is going to be promoted in government facilities such as DMVs, also in government hospitals, VAs, healthcare facilities. So there should be this promotion for a lower cost insurance, because you wanted to affect as many of the people who are young, students. They're the young invincibles. Not invisible, invincibles. And these are the people that think that they can get away without health insurance. But you want to give them an incentive, and by giving them the incentive, it will be like you get a reduced price in your registration if as a young person you have a medical savings account, or if you have a healthcare insurance coverage by the time you're 18. So if as a young person I know, like, well, I'm gonna, if I have medical savings account, it's a savings, then I can get reduced co-registration. Then also you can do something like, let's say you go state by state. Okay, the first state that can have the most coverage, like let's say they're covering their people by 85% to 90%, that's the state that's going to get subsidies from the government for, let's say, railroad. We're going to give you 10% more for your railroad because you achieved this much. And then, so that makes that state take care of it. But right now, the federal is covering for, it's called a Medicaid expansion, and the federal is going to pay 90 to 100% of the Medicaid. So the people that can't afford it are all subsidized with Medicaid. Well, what's going to happen is the state is not responsible for it, so they're kind of happy right now. But as the number of people increases under the Medicaid, and we're hitting a ceiling, I mean, we're going to stop government function at some point this year, because it's hitting the ceiling again. Then they're going to be